Good afternoon, and let me at the outset thank Ms. Indika, the members of the Committee for Engineering Services of the Institute of Engineers, Sri Lanka, for inviting me to give this talk. It's a matter of sharing some thoughts so that I'm sure would be useful for all of us to lead a healthy lifestyle, or to have a healthy life. And I would like to take you, and also thank you for a flattering introduction, thank you. And take you through this topic, if we want to lead a healthy lifestyle, we need to be aware of the diseases, one side, and the reason for us to fall ill. And then, of course, to what are the methods that we should adopt to try and prevent the diseases. I mean, basically, that's one side of the story. Refrain from diseases. On the other hand, and we should also try and cultivate good habits. That's another additional side of the story. So let's first look at this, like what can we do to be away from diseases. So it's before we try and cultivate flowers, we should get rid of the dirt. Before we try and do good things, meritorious things, we should try and purify our thoughts. So when it comes to the ailments, can broadly be divided into three groups: physical illnesses, mental illnesses, and the physical illnesses as a result of mental psychological impact disease. Most of the time it is actually psychological, in the sense there is a psychological reason for us to get somatic manifestation. Somatic in the sense, like say one would get headache towards the end of the day. It may not be a physical thing, it is like burden of work or some other reason. So it's psychological, and in fact a huge category of diseases fall into that. On the other hand, there is a physical ailment, say myocardial infarction, heart attack. There is obvious clot causing myocardial infarction. On the other hand, there are a group of diseases which are completely psychiatric, well, from the mind itself. So the psychiatric, physical and psychological reasons causing the disease. And when it comes to the psychological, the physical, kahika, can broadly be divided into two: the infective in origin, communicable, and non-communicable. And in fact, in the past, as you can remember, probably we were burdened with a lot of communicable diseases. Like wherever we eat, we end up with loose motions, and blood respiratory tract, gastrointestinal tract, a lot of other infections. It's rather common. And malaria, well, but still we are burdened with communicable disease like dengue. But at the same time, non-communicable diseases are on the rise. So we have actually a trend of coming down the non-communicable diseases, like due to vaccination. We have got rid of a lot of, like even polio, we hardly see now. In fact, that will be the next vaccine to be deleted from our national immunization program, because we have almost eradicated. But to compensate for that, we are facing another burden of non-communicable disease. In fact, we have right at the moment have got double burden. Right, we haven't yet done anything for tuberculosis, like dengue, but also communicable disease. That's the trend. It's like, I mean, this picture, one side like Pallegama, other side the Matale. So this is the one place I like very much, the Riverstone. Well, you get three climatic conditions. No, here it's like Nureli. So, in fact, it's a nice road actually, and this road up to, with all these pictures were taken by me. So this is what we see. Let's look at the communicable diseases. So I was talking about the way of preventing diseases. For that we need to know what the diseases are, and the diseases could comprise of communicable, non-communicable. This is the communicable, non-communicable diseases. Non-communicable diseases related to the nutrition, related to the cardiovascular system, related to the respiratory system. Like that, there are number of diseases related to different systems, and I have picked up the major ones, what we see in the day-to-day life. The related to the nutrition, two sides of the story. One is lack of nutrition, malnutrition. On the other hand, the overnutrition. That's as far as the carbohydrate is concerned. I mean, you may get fatter, fat, and or else slim due to lack of carbohydrate and protein, calorie malnutrition. Fortunately, we hardly see 14 calorie malnutrition now. We actually are overfed. We do see more, we have got excess. That's overnutrition. However, although we think that we take enough, but we have not got essential food items in it. Like for instance, we still see a lot of iron deficiency. We still see a lot of vitamin deficiency. In fact, the worst nowadays what we find is vitamin D deficiency. Even yesterday I found one girl with very low vitamin D level. In fact, it's very common in executives. No, because you know vitamin D is synthesized in the skin on exposure to sunlight. Lack of exposure to sunlight. Well, it's the air-conditioned room, air-conditioned car, never get exposed to sunlight. And it's a big problem in the executives especially. In fact, they say they come, well, in fact, you won't believe that the vitamin D is synthesized in the skin on exposure to ultraviolet light, which you get early morning, like before 10 o'clock, not the hot sun actually, early morning sun. And some people claim that they come early for work, they are in the environment where there is no sunlight. And it is a big problem. So, what happens if there is no vitamin D, then serum calcium drops, calcium has to be mobilized from the bone, and one would get bone pain and even weakness of the muscles. So one can get this kind of, so that is a big problem. So although we overlook these things, say iron deficiency, other vitamin deficiencies like B12, folic acid deficiency is quite common among people who take alcohol, because that's what you get in fresh fruits and fresh vegetables. I mean, people do take bites, but it's all proteins most of the time. They hardly take enough fresh vegetables. Fresh, actually, it has to be fresh. And so folic acid deficiency is rather common. So there are deficiencies of that nature. Keep that in mind. Like, one can check oneself actually by doing this, whether you have got the enough weight for the height. In fact, if you can even jot it down and calculate yourself, I think it would be useful, at least even at the end of the day, because just get the weight in kilograms, the height in meters, the weight divided by square height is the body mass index. Weight divided by square height. I think engineers are always very good at arithmetics. I always tell our medical students, because that's why we ended up being doctors, because we are not that good at arithmetics actually. It's a big sum for us, but I think it's nothing for you. Right. I think it's the range one should maintain it between 18 or perhaps round figures 19 and 25. Okay. So one should try and maintain it. In fact, you can do it yourself, and most of the time it is not undernutrition actually. You fall into that. Not only that, remember that you might get the false sense of security if you get within, but remember, some of you might have abdominal girth, high abdominal girth. There are other measurements for that. So it's back in this part of the world, you get central obesity. You may feel a false sense of security. I'm like, oh, I'm fine within the range. But if you have got a big tummy, which is also not healthy, remember that, because everything is in the stomach. Okay. So that is one thing we can. So what remedy we can do actually, if you are talking about new micronutrients, we should try and take a balanced diet. It's not big chunk of rice actually. So some rice, vegetable, fruits. In fact, it's like, in fact, I can remember I took this picture from in Ho Chi Minh, in fact in Sheraton Ho Chi Minh. This was the breakfast in a 5-star hotel in Ho Chi Minh, because these are all local fruits. I mean, like, I don't think we ever serve this kind of things in our Hilton or Sheraton is just to come, right? Right. Yeah, and so the rambutan, jumbo, and everything, and it's like from the local fruits. In fact, remember, our apple has got a covering. In fact, the other day, one of the Australian professors went with me to Kandy in my car. In fact, he was telling, Anura, your apple seems to be shinier than ours. What happened is, because the moment you pluck it and you put it in a wax, and that's how it's shiny. And also, so I mean, when you eat it, make it, I mean, after all, there must be a method of keeping it for all these years. So you have to peel it off, right? So I mean, those are the issues, but we need to take enough fruits. And of course, here it's not there, vegetable, which is not that expensive actually. We should try and, I mean, kolamallum and traditional Sri Lankan diet, in other words. In fact, even the other day for diabetic people, there was an argument which is better, because number of, with vested interest, a lot of papers come. Somebody was telling the basmati is better than our rice. No, actually, I must say that the Sri Lankan Kambapuhal or the parboiled rice is probably the best if you can eat, if you have got diabetes or even otherwise, because it's bulky and it has all the nutrients, and then you eat less compared to white rice actually, and also of course you get vitamin B covering on top of it. So parboiled rice probably is the best, and in fact if you stick to what people used to eat in the traditional Sri Lankan diet, okay, we don't need actually. I can remember next door when I was the president section A and also president's chairman popularization of science, and we used to go all over the country giving lectures. In fact, one day we had a lecture in Buttala, and it was sponsored by Unilever actually. I'm not scared to tell that, but it's okay. And then there was a nutritionist who gave a lecture for the students of Buttala, Mondragala district actually. I was telling, well, they gave bread and also butter and distributed all over. And then he was asking children, what did you eat for the breakfast? Then they were all telling, like, you have had rice and sambola or rice and kirihodi, right? I mean, that's a traditional diet there. And then they was evaluating rice and kirihodi. Rice is carbohydrate, kirihodi is vatura, and so where are the nutrients? So in fact, so they were trying to say that the margarine has got more vitamin A and all this, right? Fortunately, I was chairing and I could correct it, because our rice has got everything, right? That's more than enough. Rice and sambal is enough actually. You don't need additional artificial things into that, right? Of course, that has, so and make sure that you eat other things as well, right? Of course, fruits and things, right? Okay. So, like, look at this. In fact, this is the Rathrathkota road, which I took actually right from Matale to Riverston, that road. I mean, it's plenty of fruits. We do get it. And it's not spoiled. Look at how happy they are. So, we need to have actually a balanced diet, and of course, Kramavat is, I mean, you need to like take a good meal. I mean, that's a big problem with school children nowadays. Like early morning, they hardly have any time to eat and may take a chunk food and go. And that's the reason. Those days, in fact, when we were medical students, there was no disease called gastritis. Now people will say gastritis. Why? I mean, because they hardly take enough food. I mean, like now they keep on closing McDonald's in places where they built up. Now we are trying to absorb McDonald's and KFCs. Do we need? I mean, you have to ask yourself. Of course, once in a way for a fun, one can have it, but not for regular things. And of course, if someone is not growing, like if someone has got a BMI which is lower than normal, one should always find out, have I got any other disease? Maybe maybe having an infection, maybe tuberculosis, maybe a neoplasm cancer, or any other chronic disease. So one should always look for a reason. Of course, you need to get to a doctor and try and evaluate as to why am I not growing. It can't be only nutritional. Or most importantly, especially for children, if you need tender loving care, actually, like sometimes if the child is brought up in an environment which is psychologically unhealthy, that can affect the growth. I mean, if the parents are far away, actually hardly any attention, then that can affect. And also the stress of work, of course. I mean, not relaxed actually, right? And then we actually try and make ourselves stressful. I think any event can be stressful, but an event is stressful to one person but not to the other. So it's how you take up the things. I think there are a lot of ways of doing that. One of the way actually is to try and live at present. Will you all get up, please? Will you all get up? Yeah. And then just relax and close your eyes. Close your eyes and now concentrate on the top of your head, and then gradually go down and down to the right side of the ear, the right side of the chin, then the neck, then the right side of the shoulder, then the hand, the fingers, and then come back to the elbow, right, the axilla, and try and rotate it around the body 3 times. Okay, thank you. You can open your eyes and sit now. Yeah. That's so actually, that's focusing on your own body. I mean, you can do it in different ways. You can just sit and concentrate on your breathing. I mean, that with that you try and get rid of all the problems, at least for the time being, right? In fact, it's very well shown with that. I mean, it's kind of meditation actually, but with that your blood pressure comes down. It goes up with adrenaline, another hormone. Adrenaline level comes down. There's another hormone called acetylcholine that will increase, and you calm down. And so we actually hardly pay attention to our own mind and the body, and we keep on working like a machine, and we think about only the physical things, but we hardly pay attention to the mind. In fact, I can remember I attended a workshop on high blood pressure way back in 1990 in Cambridge, and those in 1990, mind you, and we had workshop for 1 week, and they got down people from India to demonstrate yoga. So because, I mean, they're conducted by authors of books, and they had enough and more drugs, but they showed the value of non-pharmacological methods of reducing blood pressure without using the drugs. I mean, you can. And so because we get high blood pressure due to the reasons like things what we eat. We take a lot of salt, and then the blood pressure goes up. And it has been shown, like there was a study which was conducted in a tribe living in the Amazon. They don't take salt at all because they are far away from the sea. They don't take salt, and their blood pressure is rather low. And in fact, as we go towards even otherwise, we tend to take salty food, and the blood pressure goes up. And then the stress Of course, there is what we call white collar hypertension. White collar in the sense when they come to the doctor, the blood pressure goes up. It's like that. So like that. So it's stressful environment. So but if you can devise a method to calm down, which can be done in between. I mean, there is no time for you to go and sit and meditate, but at least in between, if you can do such a thing, some kind of a mental exercise, which will not take a lot of time, and so that held a big day, because it will make the internal environment clear and your stress goes down. So like how happy they are, less stressful, right? Okay. And then we were talking about the communicable, non-communicable diseases, and out of that, one of the important things which is relevant to all of us is high blood pressure, the cardiovascular system, and then heart attacks, the coronary artery diseases, ischemic heart disease, which is the same. The bronchial asthma is on the rise due to several reasons. I mean, it could be environmental in the nature, in the sense that environmental pollution. In fact, we ourselves have done a study and found 17% of the people living in the city of Colombo has got wheezing of some sort, compared to a group living in, say, Malabe, in the midst of Malabe, that's called Rambuk Well, a small village, and they are hardly any. They live in the natural environment. So this area, there are some environmental reasons for that. And then, of course, diseases related to the alcohol consumption and liver diseases. Of course, then of course, the drugs related diseases, and also don't forget, young people do commit suicide for trivial reasons. I mean, it's another important issue that we should remember. These are some of the important non-communicable diseases that we should address. Like, for instance, people do smoke. I mean, like looking at a mother of two or your baby. I mean, do you think that she's, what do you think, or what do you observe? Actually, I don't think that smoking helps, because she is completely unhappy, look unhappy. Actually, people do smoke, resort to this kind of things, the drugs, due to like unhappiness or get away the problems. So we should try and find the ways and means of doing that. For that, actually, now Sri Lanka is blessed with a lot of religions. So I think no religion talks ill about anything. So I think one should make use of one's own religion to get rid of all these menaces. I think that's, I have a strong belief on that, right? I think, and of course, we live in a multi-religious, multicultural society, and we should make use of it. And similarly, like a father of two, of course, let's smoke, drink, why? To get rid of their problems. But do you think that this will solve the problem? No, this will add fuel into fire. Like when it comes to our own data, like when it comes to the death certificates, 27% of our deaths are due to coronary artery diseases, ischemic heart diseases. And of course, followed by diseases related to the gastrointestinal tract, mainly the liver diseases. Then comes the respiratory tract. Cancer is the fourth, and then of course things related to poisoning. Of course, that vary depend on the situation. Like for instance, agricultural areas, you get agrochemicals. Then of course, in more affluent places, you may get paracetamol or any other drug poisons. Of course, then one can also get strokes and other diseases. Now, these are one study which I have done. I'm the consultant physician in Sri Lankan Air Force. In fact, a study done over a period of 6 months, and there's analyzed data of 338. 31% has high blood pressure, and all these people were taken after a rigorous medical program, because they were all healthy when they got in. After being there for some time, got heart diseases, asthma, diabetes also rise, right? So this is a true picture in our society. And then the diseases related to the communicable. So we were talking about non-communicable, and then let's move on to the communicable sides. In fact, but nowadays, of course, because of the less overcrowding, some of the things are coming down. However, still we see respiratory tract infections, diseases of the gastrointestinal tract, like Of course, fortunately, most of things are much less than what it was. Like in the past, dysentery, typhoid, there were problems that now hardly any. But still, in youth, but I've always put this: the problems related to unprotected sexual intercourse is is still a problem, right? I mean, people don't talk about it, but it is a fact, right? In fact, well, when it comes to the sexually transmitted diseases, there are diseases with ulcers, without ulcers, and the other group. Those with ulcers are syphilis, chancroid, herpes. Herpes simplex is like cough and cold now in our society. I must tell you that it is such a common problem. It's very infectious, painful ulcers, shallow ulcers. Maybe they are for some time, get better, and the viruses remain in the nerves and recur over and over again, and can go to the partner and to the child as well. And it is a big problem. And then, of course, syphilis is much less because it can be treated with penicillin, and it has come down. And chancroid is another painful ulcer, and which can also be treated, but herpes simplex cannot be treated. Okay, so one has to, even by using condoms, one might not be protected, okay, from herpes simplex. And then the one without ulcers are the gonorrhea. Gonorrhea is there you get the white discharge, and then of course the other groups include HIV, AIDS. HIV person can get AIDS, viral warts, scabies. Hepatitis B is also a sexually transmitted disease. This is chancroid ulcers. Even the child, if the mother is having syphilis, the child may be born with it, but those things are now detected because there is antenatal screening and treatment. It can be treated. And there is another chancre here which is short, ulcers, and these are the small ones which you can't see very well, but in the glans penis you can see the herpes simplex. Herpes simplex, painful, small, superficial, easily ruptured, several. And then of course gonorrhea in females may be hidden, and the males, so it's called Sudubindumaya, where you get a white discharge, and because there is a discharge, they come to the doctor early and gets treated. This is easily treated, of course. These gonorrhea, of course. These are the viral warts in the glans penis, of course viral warts in female, even in the anus you can get this kind of illnesses, okay, and HIV/AIDS. So all these are problems. And why do people get it? Due to unprotected sexual intercourse. I mean, it's my duty to tell because it is a problem. Okay, we do not a single day that I have not come across a patient with any one of these, right? So and so therefore it is our duty to tell, right? And but of course we should think ourselves, it's not that easy to protect, I know that, and therefore it's very easy to say refrain from everything, but we should have some strategies. That's why we say, like, of course the best is to stick to your spouses, and if unmarried, not to have sex. But if one cannot, then try and use at least condoms. Use of condom prevent most of these diseases to a great extent, but not 100%, I must tell you that, right? But, and also it's by touching wet surfaces that most of these diseases are contracted. Like, in fact, it's the wet surfaces in the sense the mouth, the glans penis, the vagina, and the rectum. So if by just touching, hugging, one would not get sexually transmitted disease, don't get scared. Otherwise people get scared for everything, right? So, but it's not, I'm not causing any phobia, but it is whenever there is touch between two wet surfaces, that there is a high chance. And in fact, there is another requirement, there should be an abrasion actually. Like usually what happens is when you brush your mouth, there are invariably abrasions. And especially the worst is anal intercourse, where invariably there is abrasion. So there are situations where you get high risk behavior. So one should ask yourself, like, it's way between the temporary satisfaction and the long-term consequences. That's why I say the religion helps, whatever the religion. I think that is the only way out actually. Otherwise, self-discipline is not easy. It's not easy. It's easily preached than done. Then of course, I told you, on one side we should be aware of the diseases and we should try and refrain from getting diseases, and if we are aware of that, then we should try and cultivate our good habits. Good habits, that means the other side of the story. Good habits, of course, I mean like our attitudes. There's not, I don't have to tell you this is good for the children, but you know, need to know the good attitudes day-to-day life, right? I mean, it is, if what I do is, I don't try and control anybody. I don't think we can control anybody. I think you try to correct myself. I think that's my attitude, right? Well, I'm not, because if you try to correct the whole world, I don't think you will ever do that, right? I think it's oneself. If we can protect ourselves and do our own things, I think don't even try to control your children. You can't. You can't. I mean, if you tell it once, they will do the opposite, right? So therefore, best thing is to ignore and do it yourself. Set an example to others, right? Yeah. So that's the only way that one can do that. In fact, we do that in the university. That I think one of my students is seated there and came with me, Dr. Harsha. So I'm sure they well, because in fact, although people claim that the universities, there are the students who are fighting all the time, they are not good. Actually, it's we are responsible for creating problems, right? So I think it's our job to try, and so we should set an example. Then the whole world will follow. Without us setting examples, I don't think that we will ever change it, right? For instance, now if I have a free clinic at my village at Agalavat, I do every second Sunday of the month, those days every week. Well, it's yeah, I can got this picture because see, the daughter is blind and the mother is deaf, and both are together. So making use of Sahajivana, right? Like, because the mother leads the way and the daughter can hear. In fact, now she is using the ear aid, but still daughter can hear. So mother is deaf, the daughter is blind. So both together, working together. So like that, we help each other, right? Help each other, and I think that's wonderful. Do no harm to others. Be helpful. Do no harm to yourself. Be helpful to yourself. I think think, speak, and act. That's it. In fact, then even the same clinic, actually see wonderful how happy they are. In fact, the mother is over 100 years. In fact, she died about several months back at the age of 104. And the daughter was the patient who was 84. Daughter was 84. Mother was over 100 actually. When I took this picture in my free clinic, say how happy they are. I mean, they are not rich. I mean, but they are happy. So, well, who are we? Do we think that we are anywhere near? Well, and so I think it's our duty as professionals to set example. I think there are, so we can help that way. And in fact, so only way, of course, I said sabapapa sakarana kusala supasampada, only by getting rid of dirty things that we can cultivate good habits. So that's where, like, I think it's a good practice to be religious, whatever the religion, okay? And I think no other way out. I mean, I can tell you, because I have got all the degrees under the sun, actually. I mean, no more degrees, actually. Right? It went on, I can remember. I mean, I got O levels at the age of 14, A levels at 16, I was at Royal. And then went on and on. Collected degrees and went. But do you think the happiness is there? No. And we have never had problem with money. And do you think the happiness is there? No. I think the happiness comes through you, whatever the religion. Of course, I am a practicing Buddhist, and I think that makes a big difference. Okay, so that is a different talk on its own. And then, of course, if you do practice that, whatever the way, there are ways of bringing down blood pressure, the good cells. In fact, if you are agitated, you have more chance of developing cancer. Even that is shown. There is a thing called natural killer cells. Natural killer cell activity increases, or the ability to fight against your cancer cells increases if you calm down. So, and the blood sugar comes down. So there are a lot of benefits of calming down. You have to adopt different ways of doing that. Well, then of course regular exercises. Of course, that's what is lacking with our busy schedules. But try and at least spend little time at least walking. Do something. I think it is important rather than spending money on health. I think that has to be done. In fact, this cycle lane from Stockholm. And of course, then whenever you get an opportunity, I'm sure you should try and enjoy the nature and protect the nature, of course. And for us to enjoy, we should protect it. And because this is Singharaja, the virgin rainforest, and that's why I actually liked very much this last activities. We used to go out actually, I think. So with a lot of people, and there we could enjoy the nature and we completely forget the rest of the world. So there are ways of doing things. In fact, this is Singharaja, and so see, we completely forget the rest of the world, and even the creatures. When you see, at least for a while, you forget everything. And when Pitavalla, the second world, then Patana, and see how beautiful. So a lot of things for us to do when we have things, and even certain music will help. So different as you like. And this is the height of war actually. I was in Jaffna University. I was the UGC nominee for a professor's interview in Jaffna in the height of war. The day the Inland Revenue building got attacked by. I was in Jaffna. I was in the midst of LTT actually. Yeah, because I was the UGC nominee. Like see, he's the vice chancellor of the Jaffna University, and what they do is the war was going on. And all these children, their parents, say brothers, sisters, they all LTT, okay, and were in the midst of war, okay, and so I was there actually, and they for the first time somebody saw somebody from south actually, and they had completely a different image of people from south, and so I mean I also during the lunch hour they have no way of protesting. They go to the temple in the Jaffna University. This is the temple in the Jaffna University. There's a special puja for me also, and then meditate for 1 hour. That's how they relaxed. I mean, I'm sure they are most Hindu, and I also joined actually for 1 hour, and it was wonderful. I thought, I mean, imagine, I mean, most of their parents were not contactable. Brothers and sisters were not contactable. They were in one knee. And the people from the south were the enemies actually, and I had to go there because as a UGC, I flew actually, right? And in fact, the security forces were scared to release me to that, right? But some other, and they gave the complete protection. And so I think even when there is crisis, I think it helps a long way. So this is the temple where we were. And so, and also we need to learn how to be happy with what we have, and also productive hobbies. In fact, as children, we used to do a lot of productive hobbies actually, right? Even as small children, we used to collect stamps, you know? Like do something of that sort. But I don't know what now the present trend is, okay? But iPad is not going to help. Okay, I think it will hamper the brain, right? We can see that. I did the PhD in Japan. I know we were not allowed to touch any machine. We worked from scratch. I mean, I learned how to make a 0.9% sodium chloride in Japan. Here we buy. There we have salt, distilled water, and we make it from the scratch. Okay, so I think be careful whatever said done, because the brain is foremost. I think we should try and protect the brain. I mean, not just use someone else's program. Okay, I mean, I don't have to tell that, you know that. And also be happy with what you have. Unless you are contented, you will never be happy. In the sense, we have to be contented, right? Because otherwise, sky is the limit. Sky is the limit. Okay, you will be unhappy forever. Right? This is what I was telling. And look at this. Now, this is the group of children I told you about in Rambut. Well, that's in Laggala Pallagama. This whole village will go underwater with this Kaluganga project. Okay, Ramukolua. In fact, none of these children had any wheezing, nothing. They were completely healthy, right? Whereas 17% of this group, we had a comparative study of the children from comparative age in Colombo had wheezing. These are the children who were living in this environment. In fact, this is the river, this is Kalungaga. This where the dam is built, and this will go underwater, and they just jump into this river and happily live. And the parents go for China cultivation, and there were 2 teachers. They look after him in the afternoon. They are there all the time, right? And I went to do a free clinic. Actually, there was no necessity for free clinic. Everyone was healthy, right? And other than if we go and spoil them, only the problem arises. Okay. And this, in fact, on my way to Lagala Pallegama, and we saw this actually. He was the dental surgeon actually who found this, and then found this, a sambar. Surely, what happened was, yeah, it's a sambar, and was trapped in this one. So poor sambar. And so what do you do? In fact, we were going our way, and what option will you take? Now you are on the way for your research, and you see the sambar trapped, and these are the options actually. I mean, like take it home, leave the animal and continue the journey, inform the police, inform the wildlife department, stay with the animal until it is rescued. And those are the options I had actually. And it's up to you. I think if you are going for a very busy thing, of course you'll have to continue, but we stayed actually. We were going for a research, so we could do anything, but we actually stayed until it was rescued. Actually, I informed police as well as wildlife. Fortunately, I'm SSP to police as well, so I'm a doctor in the hospital, the Narayanpet Police Hospital, so I was influential in that way. But actually the wildlife people came first actually and rescued the. So we were waiting, and well, in fact, they came and anesthetized, and we managed to send the sambar to Vasgamu actually. Can you see? So it's fun actually. I mean, like when you are out of these actually, and you don't see this in Colombo actually. So so you can actually help. So it's a matter of helping somebody, and what a lot happiness you get out of that. And then, of course, ladies and gentlemen, I was talking about the diseases, the reasons for it, and some ways of reducing it. May you all be happy. Thank you for listening. If there are any questions, I will be very happy to answer actually. Yeah.
Blood pressure, earlier they said 120, 80.
Yeah.
Now, what doctor told me, now it's 140 and 96.
No, one cannot be dogmatic actually. It's a range. It is a range. And therefore, 120, 80 is the average. So all these biological values have a range. Say for instance, so for treatment purposes, we just simply don't treat just the 100 and sometimes we wait up to 160, 90. Even before that, even with that, we try and give a non-pharmacological method of try and reduce the blood pressure without drugs, non-pharmacological. Because if we start treatment for high blood pressure, we have to continue it for life. If a person has got high blood pressure, first thing is not just the casual reading. We'll have to recheck it. And if it is there persistently, then we need to find out whether there is any underlying reason for high blood pressure. Because there are certain other diseases like kidney diseases, endocrine diseases, okay, causing high blood pressure. So we need to try and look for the reason for high blood pressure. On the other hand, we should also see whether there is a target organ damage. There are three important target organs. One is the eye, other one is the heart, a third one is the kidney. If I can find easily out the defect on the kidney by doing urine test, urine albumin is present, that means there is something wrong with it. by looking at the eyes with the ophthalmoscope, one can find out whether there is any impact on the eye. And just by keeping the hand, one can see whether the heart is enlarged. So, if there is target organ damage, even with blood pressure of 140, 80, I would treat. If there is no target organ damage, we can buy little time. Of course, if there is a young high blood pressure, hypertensive, we should do extensive investigations to find out the reason for it. So, if it is at age, blood pressure of 160/90, if there is no target organ damage, I would give a time of about 1 or 2 months, couple of months, and if the person is doing sedentary work, ask them to go and exercise, regular exercises. In fact, it's a myth that the blood exercise will increase the blood pressure. No, if you do regular exercises, blood pressure will come down. It should be regular, it's not a strenuous exercise, and should be part and parcel of life, right? Swimming, probably if you can, jogging, walk, if not, at least walking, and the walking to a such extent that you should be able to talk to someone else. Like, it's not like you are not going to train for a marathon, but that's why it's better to have a companion and keep on talking and walk, and then you don't overexert yourself, because you should not be panting. Panting means there is something wrong. Okay, so then the blood pressure comes down, and then of course cut down on your salt. If you are putting additional salt, cut it down, and then of course spend little time for a bit of meditation. Actually, we spend a lot of time on physical things, but we hardly spend time on controlling the mind, purifying the mind. I think it's time for us to do that. Think about it. And because without that, the mind is foremost. Manopabangama Dhamma. So mind is foremost. Therefore, we have to try and clear our thoughts. I mean, there is no other way. I mean, I can tell you I got everything, but still the happiness coming through that. Okay. Yeah.
Some say breathing therapy, breathing therapy and water therapy and walking therapy help to get the calm and cool down and get the pressure go down. How is actually this?
Yeah, no, the thing is this: when you do regular exercises, for instance, and then the heart contracts. When the heart contracts, rather than this idling, when you idling, heart doesn't contract. No? So then the heart is a pump, and then you get the pump into action. Then the muscles keep on contracting, and the muscle power increases. If you just idle, it will not contract. In fact, there is a law called Stalin's law. The initial length of the muscle fiber is directly proportional to the force of contraction. Initial length of the muscle fiber is directly proportional to the force of contraction, and initial length, if you plot it, initially stroke volume is with each contraction the volume of blood which is ejected from the heart. Okay. And when it comes to 1 minute, it's about 5 liters. So when the heart is stretched, then the more blood is pumped out. But there is a limit. Stalin law has also a limit. It goes up and then it plateaus. Obviously it gets overstretched, then that's a disease process. Okay. So therefore we should get the muscle to work. Otherwise it will idle and it will be floppy. It is not good. So you get enough energy. I think it's very important that you get the person to do exercises. Okay. And of course breathing exercises help, because if you don't breathe, actually most of the time there are a lot of alveoli that are not, which are expanded actually. So that's why we do yawn. Why do we yawn? Because the alveoli are collapsed, and so there is a natural mechanism of expanding. So take a deep breath in. And in fact, I used to teach at KDU, because our KDU, the Ratmalana, Kotalal Defense Academy. There's medical school. And in fact, one thing which I didn't see in our national universities, well, because they get up early morning, they're tired. Actually, when it comes to lectures, some of them fall asleep. So what they do is, that's how they have been trained. They get up, go and stand behind and take a deep breath. Then they are fresh again. and then after a while they come down and come and sit. Whereas so most of our places, I mean, people are scared to get up, no? I mean, so they just, I mean, they are seated, sleeping. But might as well sleep at home. If you are coming for the lecture, you must make the maximum use of it. So I thought that's a good thing, right? I mean, you are the own judge. I mean, nothing to blame. I mean, we fall asleep. Say after dinner, perhaps you may fall asleep. So if you feel sleepy, you are the best judge. You get up, go, take a deep breath, good breath in, and then you are fine. So there are ways of doing that. I think as long as you do the correct thing, I think there is nothing to worry, and nobody will laugh at it. Okay. Yeah. Okay. Well, not to my knowledge actually, but it may be true, right? Another benefit of meditation, right? But what we generally advise is actually try and cut down on starchy food. I think we eat more. We eat more. I think no harm taking green leaves, vegetable salads, you know, and but try and cut down on starchy things. I think that's the mistake, because refined sugar. Of course, because we take, I think it's advisable not to take sugar, unnecessary sugar, after the age of 40, right? Because we take more sugar. What do you need? I mean, like if you get used, I mean, I was in Japan for 5 years doing my PhD, and I hardly use any sugar. I mean, there you use green tea. Okay, so I mean, and that's why they are slim and thin, like. Sorry? Yeah. Usually it's called 40 years of age. 40 years of age, because after that one can develop high chance of developing diabetes, obesity. Yeah, because you don't need calories actually. We do, and what happens is if you like eat and then go and sleep and everything is in the stomach, and then so I think we should cut down on starchy food basically. Yeah. Yeah. Yes. Well, the problem is gastritis. When you skip meals, of course, if you are fasting, then the acidity increases, right? If you are skipping, take plenty of water. That's another thing. I mean, you have to take water, enough water, that will dilute, because the pH of the stomach is as low as 1 to 2 hydrochloric acid, HCl. So, I mean, if you don't take, like you get HCl. And then the worst thing is, people do take like NSAIDs, different painkillers. Painkillers will inhibit prostaglandins. Prostaglandins is another, I'm sure you know. The prostaglandin is required to make the mucous membrane of the mucous layer of the stomach. So due to lack of prostaglandin, the mucous layer is damaged. Then the mucosa is directly in touch with the HCl, pH of 1 to 2, and cause erosion, gastritis, ulceration, bleeding. Okay, so therefore, skipping the meal is okay, provided you take enough fluids so that you dilute the HCl. And the second thing, of course, no harm taking high fiber things. That will not add fuel. Like any salads, okay, I think salads fine. Any amount of salads, don't worry. I think we eat less salads than what we should, and we eat less fruits than what we eat. Lot of protein. Well, actually, I don't discourage protein in Sri Lanka. We actually take less protein actually. I mean, like we don't eat chunks. Like for instance, compared to West, our diet actually has got less protein actually. To be honest. So therefore, there is no worry about protein in our diet actually. I mean, like I'm talking about in general in a family. I mean, a little protein we have shared by everybody, right? But it's not the case in Western diet. They take mainly a chunk of protein, right? So they are actually, because there are some concerns about carcinogenic effect of protein, right? Carcinogenic means effect of causing cancer. But those are the things. But I think if you like, but But remember that, don't get scared. I mean, there are a lot of vegetarians, right? So, I mean, that's perfectly all right. I mean, if you take like especially curd or the dairy products, even Italy, those have B12 if there is a concern. I mean, there are a lot of people who are vegetarians. I mean, they get B12 from those sources. It need not be on always animal. We are not carnivorous. Okay.
When you do older, will the pressure limit goes up?
Yeah. With higher, yeah, older you are, higher the blood pressure. Usually for an elderly, now I told in general 160, 90, and we might not treat even up to 180 when it comes to elder life. Yeah, blood pressure goes up gradually. It's low in children, goes up. Yeah, it gradually goes up with age. It gradually goes up with age, but the blood pressure, actually there are two components, systolic and diastolic. You know. So the systolic blood pressure goes up higher than the diastolic. So if it is high, but the problem in elderly is it may rupture, and that can cause stroke. That's a higher the blood pressure, the higher chance of rupturing. And therefore, that is the reason why we reduce the blood pressure in elderly. Yeah. That's the only concern actually, because I mean, why do you want to have a stroke? I mean, which can easily be prevented by reducing the blood pressure. Yeah. Yeah. Very good. Sure. Sure. Actually, it's vitamin D supplements. Yeah, because no other natural thing actually. Well, of course, dairy products have calcium. Because what happens is when vitamin D is low, serum calcium declines. Serum calcium comes from three sources. One, of course, from the gut. Second is from the kidney. The main source is from the bone. The moment the serum calcium drops, there is demineralization of bones. Calcium is mobilized from the bones. So the bones get fragile, and elderly there can be fractures, you know, that's why they get fractures. And it's not osteoporosis, this is called osteomalacia. Osteoporosis is different, this is osteomalacia, and where the serum calcium drops, the bones get more fragile because of calcium is mobilized. And then also for the action of the nerve you need calcium, for the actions of the muscles you need calcium, and then we can get proximal muscle weakness. Proximal muscle in the sense when they can't get up from squatting posture, and also they can't raise their hand and comb their own hair. The proximal muscles are weak, osteomalacia, and also the bone pain, low back pain, and the nerves, due to the reduced activity of the nerve, get numbness, especially perioral numbness around the ear. So there are it can lead to a lot of vague symptoms, which may go unnoticed. And also people usually don't do serum calcium in the routine analysis actually, and also of course whenever I suspect, I of course do that, but usually it is not done. And also vitamin D is hardly done actually. One reason, of course, the assessment is quite expensive. I always ask, it's about 10,000 rupees, but it's worth doing it if there is a suspicion, right? Because it is something treatable, and if it goes unnoticed, it can lead to a lot of sequelae. And if that is the case, we don't advise them to go to the sun. It's not practical, no? I mean, like some people. So vitamin D supplements are there. So how? Yeah.
What do you think about the yoga, meditation? How does it affect for the health?
Yeah, definitely it helps. Only things that helps in different ways. One, of course, the physical benefits. That's what you get, the reduction in blood pressure, reduction in the sugar. The other benefit is, of course, is the self-discipline. No? I mean, because you need to, right? There is time to get up, then you have rituals in the morning, the rituals in the afternoon, then the life is comfortable. Ultimately, what do you want in life? You have to ask, why do we live? Ask yourself, right? actually, right? Then so always, I mean, then the life is very comfortable, very comfortable. I think one can get a lot out of the life actually. Right? Well, do no harm to others, no harm to yourself. Be helpful to others, be helpful to yourself. Think, speak, attend. And in fact, it's a mental exercise, constant mental exercise, which you and I can do actually. I don't expect everybody to do, but because we are above the average in the sense intellectually. So you and I can do that. Okay. Nothing is impossible. Yeah. Yeah, dementia. Dementia is a disease where you get lack of memory, short-term memory. Like especially as you grow old, we get what is known as dementia. Dementia is a lack of short-term memory, and with old age, and that is usually grandmother. She has forgotten where she has kept the key, but she remembers the thing what had happened during the time of Second World War. It's like that. So that is a fact. But if you get it before that age, and it's called pre-senile dementia. Pre-senile means like still at your age, if you get demented, of course you have to think of a cause. It may be due to lack of certain endocrinological diseases which are easily treatable. One such thing is of course lack of thyroxine. This is also on the rise because we now give more and more iodine than required. I think every salt has a lot of iodine, fortified iodine. And in fact, we have got now problem of excess iodine. Okay, as a result, we have got a lot of hypothyroidism in the country. Lack of thyroxine. That is a huge issue, I must say, although I have not talked about it. And that can also lead to apathy, dementia, and is no harm. If anybody feels drowsy, lethargic, difficult to get up in the morning, and not efficient as you were, worth getting serum TSH done, thyroid stimulating hormone. If it is anything more than 5 milliequivalents per liter, I think need to get thyroxine because it is such a common problem. I must tell you that. Okay. So TSH, thyroid stimulator, TSH, serum TSH. That's the screening test for lack of thyroxine. Because when thyroxine goes down, thyroid stimulating hormone goes up. It's a negative feedback. TSH is coming from the pituitary gland. And when the thyroxine is low, the TSH goes up and the normal upper limit is 5 milliequivalents per liter.
One more question, sir. This is one clarification for body mass index. So, one more doctor advised me that to maintain body mass index to the healthy body is between 18 to 25. But he initially told me that X value is not a practical value for the country like Sri Lanka. Is it true?
No, the thing is this, better not to be dogmatic actually, that's the thing, right? That's fine because I don't think we have not got a value for Sri Lankan, right? Okay. So because we are thinking, I mean, you are worried like if it is, because probably it is probably 18 or so in your case, right? So don't worry, right? It will be healthy, right? Okay. So because always there is a reason why you justify things, but it's okay, right? Don't worry, right? But it may be true, but we have not got our own values, right? Okay. But if you are concerned, what you should do is get to a doctor, do the basic investigation for loss of weight. Reasons for loss of weight. One thing is diabetes, of course, better to be on the safe side. If the body mass index is low, I mean, find out whether I have got diabetes by doing a blood sugar. Whether you have got excess thyroxine, again by doing TSH we can get excess thyroxine. Whether you have got tuberculosis, that can be easily found out by doing ESR. And whether there is a cancer, that of course you go look for a clinical feature and do the relevant investigations accordingly. And those two, these 3 or 4 diseases, one is excess appetite, like good appetite, loss of weight. I mean, you keep on eating, still lose weight. That's a feature of diabetes and excess thyroxine. Keep on eating, still losing weight. And lack of excess thyroxine, thyrotoxicosis, or diabetes mellitus. The other side is lack of, poor appetite and loss of weight. That is with tuberculosis, poor appetite, loss of weight. Cancer, poor appetite, loss of weight. Okay, so one can easily find out. Okay, so the clinical medicine is very interesting actually, right? That's why we see 20 patients in 1 hour. Okay. Well, ratio actually we stick by the standard, world standard, right? So because we haven't got our own standard here. Maybe true, but if we are making any doubts, we have to have our own things, no? Otherwise.
Number of hours we should sleep.
Yeah. Also good question. Actually, the sleep, which I have not talked about, there is a very good study, which like U-shape in the sense those who sleep for 7 hours and they are quoted as a world study and correlating that with lifespan, life expectancy, and lived longer than those who lived less than 4 hours and more than 11 hours. So too much sleep is also not good. More than 11 hours, if you keep on sleeping, that will reduce the life expectancy. And also if you sleep less than 4 hours, that constantly, right, not once in a day, it's okay, but that will also affect the life expectancy. So the average is like around 7 hours of sleep. And also it should be a sound sleep in the sense, because there are two, like you get non-rapid eye movement and a rapid eye movement. There are different phases of sleep. So for you to get a good sleep cycle, you need 90 minutes. So I mean, if you keep on breaking sleep, then it's not a good sound sleep, no? So I would encourage actually not to have a nap in the morning, during the daytime. That's not good. I mean, might as well have a good sound sleep at night, right? That will be, because if you have a nap, what will happen is you are cutting it down from the night, good night sleep actually, which is not that healthy.
The brain sleeping time, one doctor called 1 AM to 4 AM, effective time.
Yeah.
Early morning 1 AM to 4 AM.
Yeah.
Same is the brain sleeping time.
Yeah, that is true. That's because for people who are working during the day, well, it's differ. Like that's a big problem now. People working at night.
Not to cram.
Yeah, that's true. That is true. So but you can have your own adjust your own time, right? But it's a big problem for all of us actually. We try to sleep less than what is required nowadays. Yeah. But always I think better to plan in such a way so that it goes with the diurnal pattern, because there is a diurnal pattern.
The toxins come out 10 AM, 10 PM, 11 PM at that time. Toxin releases from the liver.
Yeah, that may be true, because it is that depend on your lifestyle, no? Because that depend on the person's time you take your meal, time you get up in the morning. So different people have different lifestyle. Yeah, nowadays because people do travel as well. But try and have a good night's sleep. I think personally, try and cut down unnecessary sleep during the course of the day. Then you have, if you can find time at night. Yeah, because nap will hamper your good night's sleep, because you don't fall asleep at night, no? And if there is early morning awakening, think of depression, right? That's another reason for people who are depressed. They get up early morning awakening, which is treatable, because endogenous depression, and or reactive depression. Reactive depression is your children are far away, and then you may be thinking, and then you get up early, right? Or else that's. Well, that's good old theory. Yes, that's fine, but I wish we, like now that's in Sri Lanka, no, in the country where there is like in summer in the UK, well, 3 hours of sleep, well, sunrise, sunset, no, yeah, it is fantastic, no, because I mean sunset around 10 o'clock and 3 o'clock in the morning again sunrise. So it's applicable to countries where there is 12 hours of sunset, darkness, and the 12 hours of bright light. But it's fantastic if we can have that. I mean, as children we used to have, but now of course I think yesterday, what time did I say? It's around 2 o'clock in the morning. Keep on pressurizing me, no? That's fine. Okay. Because with the busy lives we have, right? Yeah. Yes. Yeah. Well, in fact, when it comes to, I told you, mental disorders, so the disorders can be physical, mental, or psychosomatic. Psychosomatic means major. This mental, schizophrenia falls into the category of mental disorders. Mental disorders are divided into two main groups. One is neurotic, other one is psychotic. Neurotic is minor psychiatric disease. Psychotic is major psychiatric disease. The fundamental difference between the neurotic and the psychotic is the psychotic diseases have loss of insight. Loss of insight means you cannot, well, the patient doesn't think that he or she is having a mental illness. I'm about to convince you, they might say you are mad, I'm not mad, right? So that is lack of insight, right? Okay, so that whereas others are neurotic. Well, neurotic, like obsessional personality, like obsessed, like you keep on washing, not enough washing, or you close the door and go back and come, and you are not wondering whether did I close the door, go back and come and check it again and again. Well, it's obsession. Those are neurotic. So the reactive depression is neurotic, right? Whereas the major psychiatric disease fall into two categories: thought disorders and affective disorders. Thought means a disease in the thought process. The affect is the mood disorders. There are three groups of mood disorders: mood, elevation of the mood, depression of the mood, or biphasic. Depression is depression, elevation is mania, sometimes manic, sometimes depressed, manic depression, biphasic. So those are mood disorders. The main thought disorder is schizophrenia. Schizophrenia is one of the major psychiatric illness and which needs medical treatment because it can be treated. If you don't treat and leave them alone, that can affect their psychosocial life, and completely they are the people who end up in the asylums. And that can be treated. Nowadays there are good treatment for schizophrenia. That's a thought disorder. They get delusions and hallucinations. Delusions, unshakable false beliefs, unshakable. I mean, like if they are between spouses, they may suspect, like this can break the families. Unshakable. How am I sure try to explain? No, it is not. They are convinced that this is true. Or hallucinations. They may see things which you and I won't see. Hallucination. Okay, hallucination. You hallucinate. Or hear sounds which are not there, auditory. Or may smell things which you don't others. So these are treatable conditions worth for paying attention to that. And in fact, the childhood schizophrenia is autism. Autism.
So any more questions we can ask? There is time until Wednesday 6:15 when we want to.
Explain by alkalization.
Sorry?
Explain by alkalization. When you put water, then we can say
yeah. Alkalization actually, well, it's our body pH that's around 7.46, 47, 45. Yeah, so when the pH increases, that's called alkalization. When the pH drops, it's of course acidosis. The alkalization could be due to two reasons. Well, due to a respiratory disease. Respiratory disease in the sense, if you breathe, when you keep on hyperventilating, then you wash out carbon dioxide. When you wash out carbon dioxide, the pH comes down because carbonic acid decreases. And also, then other thing is metabolic. Metabolic in the sense, I told you the pH of the stomach is 1 to 2. And if you keep on vomiting, to get rid of HIs, and the body becomes alkaline. That's metabolic alkalosis. And of course, if you vomit too much, then the pitta also comes, the bile. Bile is alkaline. And the bile, when bile is alkaline, the bile is going out, then you become acidotic. Okay, so there are different methods, reasons for alkalization and acidification, and one can actually, if the person is breathing heavily, like hysteria, that's common in girls, like when they are excited, they keep on hyperventilating, and they get alkaline, the pH increases. When pH increases, the calcium ions, ionized calcium drops. When the ionized calcium drops, it's like lack of vitamin D, and that can lead to perioral numbness around the mouth, and also the hands sometimes get tetany, cramps like this, cramps. And all what you do is get the person, take a polythene bag, get the person to breathe into that, then you are breathing into carbon dioxide, and it's getting corrected. Okay, so those are actually the first stages that actually we used to know as children, but nowadays people hardly spend time on first aid actually. Yeah. Yeah, I'll come.
There are a lot of vitamins. How do you get all the vitamins in normal rice?
The reason is that when you take white rice, most of the time when you polish it, because it's in the cover, that you get rid of it, right? Because with the parboiled rice actually, everything is retained. You boil it, then you get the covering, the husk, and then you have got all the vitamins in it. Yeah, and so the rice has got fiber, the vitamin, the carbohydrate. So I think it's fantastic. Have parboiled rice, but only thing is the taste, but it's not a big issue actually.
Only disadvantage is consumes a lot of power.
Well, to burn.
It takes about 1 hour.
Yeah.
1 hour to cook.
Yes, but if it is healthy,
Yes.
I think you can't value the health with money, no? The arogya parama labha.
Pains are very common in the
Yes.
working experience like us.
Yeah, sure. Is actually it could be mechanical, it could be medical. Mechanical in the way you sit actually. Like if you keep the back straight, I think that's very important. No, that's it important. Actually, the whole day you are seated, and so be conscious of the back, right? In fact, if you are also going to lift things, right, not to bend and lift. Actually, it said that keep the back and then lift things, right? So always take care of the back. It's very important. That's the commonest reason actually, mechanical reasons. And so in fact mechanical reasons can be corrected with mechanical means. Okay, it's like building services, I'm sure it's no difference, it's the same principles, right? Okay, so then then of course most important thing, whether there is any other underlying reason. It could be an infection, which is acute or subacute. Especially if there is an infection, there is fever and other constitutional symptoms. Then whether it is metabolic, like due to lack of vitamin D, for instance, or could it be due to an infection, the cancer, like there is a disease called myeloma, multiple myeloma, a disease of the bone, a cancer. So it could be manifested. So we need to always investigate as to why it is. Okay, and also arthritic diseases, these of the joints. In fact, I just did a lecture on that, 2-hour lecture at Ragama University this afternoon, actually from 1 to 4, right, on backache for the medical students, 4th year medical students. Yeah, yes. Yeah, yeah.
Just one question. For these exercises, for like executives like us, how long should be done for a week?
Yeah, actually, well, prefer more the merry. I think we do less. If you are to do exercise, minimum, like it takes 10 minutes to warm up, and you need to maintain it for 20 minutes to burn out and to cool down another 10 minutes. So if you leave good 40 minutes, right, I think that's probably the best, right? Because what happens is, like people say, I work at home. No, it's not exercise actually, right? Especially the housewives do say, I work at home. That's not exercise, right? Because you need to maintain the target heart rate at a certain level for some time to burn out things, right? So, and preferably 40 minutes, right?
40 minutes of
Like, no, take for 10 minutes to the warm up, then maintain it, and then cool down for another 10 minutes. So altogether 40 minutes minimum aerobic exercise.
6 kilometers.
Yeah, that depends on the speed, no? That depends on the person's speed. Of course, like I live at Borella, and after seeing patients at Durden's, I just walk actually. I can walk. Yeah, from Durdans to Borella, I walk in the evening. Fine, fantastic. Yeah. Why? I think we should not take unnecessary, isn't it? I mean, most of the time, actually, I walk as much as I can. Yeah. And so we should try and find time. I mean, why can't we do that? I mean, if we can walk in other countries, why can't we walk in Sri Lanka? I mean, like, isn't it? I mean, whenever we have all been educated abroad and we know how much we walk there, no? Right? In fact, I was there in Japan for 5 years. I had only 2 bicycles, not simple bicycles. I mean, in the university, then so one, and they take the train from there to the city, and there's another bicycle there. I mean, I can see the number of motorbikes I have seen for the 5 years in Japan. They hardly use. They use cycles, normal cycles, right? So, I mean, our country, people always want a vehicle. To be honest, actually, I don't have a car, actually. I sold it and built a temple. I don't have a car. So he has given me a lift today, actually.
After the lunch, they said, our snack.
Yeah. Sorry?
Our snack after the lunch.
Yeah, nap. Yeah, that's what I was saying. Well, if you are used to, some people need that. They have got accustomed to that, right? But the problem is that if you have a nap, then you don't, well, actually, well, it's said that the walking after dinner is better. So usually, nap is not the ideal, actually, although some people have got used to it, right? Some people have got used to it. It's not the ideal, because that can affect your day, sleeping time at night also. You don't feel asleep. Then you keep up till late, and also there is food. Yeah. Well, little bit of walk will not affect the digestion, actually. One can say reduce blood supply to the GI. No, it is not a big problem, actually. It's not a big problem.
Excess vitamin D is harmful for
Yes, thank you. Vitamin A, D and E. Vitamin A, D and E are not water soluble. So the excess of A, excess of E and excess of D can be harmful. Yes. Therefore, yeah.
How can we know?
Yes. In fact, those days we used to give like cod liver oil to children, which is vitamin A and D. So, and kept on giving that, right? Children get anorexia, loss of appetite, sometimes vomiting, okay, especially in children. So, these are some of the features of hypervitaminosis, right? So, what we should do is actually, scientifically nowadays, because vitamin D level can be checked, I think what we routinely do is if there is the deficiency, we treat them, like especially we give at least vitamin D 1000 units daily for a couple of months and then recheck it and maintain. So that's the most scientific method of this, rather than waiting for the symptoms, which is lack of appetite, vomiting, okay, and sometimes even there can be increased intracranial pressure. Yeah.
So how do you know that they are suffering from lack of?
Yeah, that's true. In fact, clinical manifestations are late. The best way is to do serum vitamin D assessment. It can be done. Vitamin D level, serum vitamin D level can be assessed. Yeah, it's a matter of getting that done. Only thing is the cost. It's worth it, actually. I think it's worth it, because we do find very often vitamin D deficiency, especially among executives. That's the group. Yeah, because I mean, as you quite rightly said, we hardly get exposed to. Not we. A lot of people hardly get exposed to. Yeah. Yeah. In fact, there are 3 categories. In fact, they have categorized into 3. Just little less than normal and very deficient. In fact, the girl whom I saw yesterday was in the extreme category. Extreme category. It's clearly stated the values. Fortunately, it is done now, actually. Yes, it's worth doing that, actually. I think we should incorporate that into all the medicals, especially executives, because rather than waiting till the symptoms come. And another problem is hives, itching, urticaria. People get urticaria, and one of the reason for that is lack of vitamin D. That's why lack of vitamin D can cause urticaria. So people keep on giving Piriton, and the moment you give vitamin D, they get better. And also another reason, lack of thyroxine can cause urticaria. Urticaria is itching, hives. Okay, allergy. Okay, and so in fact vitamin D hypothesis is the latest for allergy, lack of vitamin D and allergy. Okay.
And it says vitamin D even the mothers.
Vitamin D?
It says vitamin D even the mothers.
Yes, but lack of vitamin D also weakens the muscle. Yes, so therefore, well, I think all these things can be measured now, no? Like thyroxine. So the monitoring is required. Monitoring is required. Only thing, the money, I think, well, as professionals, we can afford to do that. Okay, and in fact, it's a problem of professionals. It's not a problem in the farmer anyway. Okay, they have enough and more vitamin D. Okay.
So this class, we like to find out the session.
Thank you. Thank you very much. Thank you very much.
So we learn a lot of things for, non-engineering things other days, as I mentioned. We learn a lot of technical things from public lecture, but today we learn our health, especially food and other practices, and physical health and mental health also, how to maintain those and to be healthy nation and to work to the country. So we as a building sectional committee, building service sectional committee, we organize this lecture, and we also have some token of appreciation for our resource person. I would like to invite Engineer Samantha Gunawardana, President of Building Service Sectional Committee, to award that token of appreciation to Professor Anura Weerasinghe. Sir, please come forward and receive the award. Yeah, there is a. Come to the stage.
Thank you, sir.
Professor Anura Weerasinghe, the chairman of Building Service Engineering Sectional Committee, including Executive Sectional Committee members, gentlemen, it was a very good lecture, valuable lecture for us to think about our healthy. So it was a very interesting lecture because we takes almost more than half an hour to your answer to your queries. It shows you how much interest the lecture. So I must thank Professor Anura Weerasinghe to deliver a good lecture to the audience, as well as I must thank to the ISL staff who make this auditorium the need to deliver this lecture, and as well as I thanks all the audience, all the gentlemen to come to listen this lecture in your EANBC schedule. So thank you very much for all of them. On behalf of IS Building Service Engineering Section Committee, ISA, I am Engineer Suru, Executive Committee member, Building Service Engineering Section Committee, ISA.